Can you hear me? Professor Andy, if you can just please confirm.
Yes, all fine. Coming across loud and clear.
Okay. So today's webinar is on capacity building through knowledge management and digital learning in sustainable development goals. And to all participants, the recording will be provided to all along with the presentation that we are showing today. Along with it, you all will be getting a certificate for participation. The link will be posted on the chat. What you need to do, you just need to fill up the form, and the certificate will be sent to your registered email ID within 24 to 48 hours. Now I'm just moving to next slide. So this is the agenda, and this is how we are going for today's webinar. So this few housekeeping announcement for participants. I can see a few participants, they can unmute themselves. So I would request all to please kindly mute your mic and turn off your video. Please ask questions using the chat box and raising your hands. So at the end of this session, once both the speakers will present their presentation, if you have any question, you can note it down during the session, and then on Q&A session, you can ask those questions if those are respective to any particular speaker, and the answers will be provided to by the speakers. There will be 2 polls. I would request all participants to please participate in the poll. Those are just the generic one. We just need you to understand. We basically would like you to understand that from which region you actually belongs to and what is your professional area. The slide, as informed to you, the webinar recording will be available in Empower School of Health YouTube channel. The slide deck will be shared with all participants, and please participate in the poll as mentioned in the previous point. There are 3 housekeeping announcements for speakers. Please turn on your cameras for better engagement. Please mute your microphone when the other speaker is speaking, and please adhere to the webinar schedule timing. The webinar objective. The main objective of this webinar is to deliver and explain the overview on the topics below. So generally, we will be taking care of 2 topics for today's webinar. The first topic, that is on big learning approach to in-country institutionalization of skill development, that will be addressed by Professor Andy. And then Dr. Andreas will be speaking on knowledge management as an organization context for institutional skill development. So now I would request my backend team to please launch poll 1. And I would request all participants to please participate in this poll. There are a few generic questions. What is your gender? What is your age? From which geographical region you are? What is your academic background? And how many works experience you have? Somehow I cannot see the poll. Vinita, can you confirm?
Yes, Sonia, this is visible and we have shared the poll with the participants.
Yeah, if you can just briefly talk that how many are participating, because I cannot see the polling right now in my screen.
Okay, so as you can see, like polling people are participating, and the numbers are increasing. So I would request everyone here to go to the polls and let us know around 25% of the participants have polled, so requesting others as well. This poll will make us understand from which geographic region you are and what profession you people are in. We have reached 60% of the participants.
So I would request other 40% to please participate in the poll. We don't have much audience for today's webinar, so I would request all to participate, please, to the poll.
Number is increasing. I'll request rest 20% of the participants as well to enter their marks. We can see around 80% of the participants has opted.
Yeah, now I would request backend team to please share the results. Hopefully I can see those. Yeah, so, I can see 100% audience who have, participated in the poll. Those are male. I'm really worried that why female audience are not there. What is the age group? The maximum is between 30 to 40. That is 63%. What is the geographical region are you from? I can see 50% are from West Africa and 25 from Central Africa, 25 from elsewhere. Okay. Then the academic background, the maximum are from pharmacy with an advanced degree. And the last question, how many years of work experience do you have? 6 to 10 years. That is 63%. Thank you all for your participation. Now we will be moving to next slide. So I would like to give you all a brief information about Empower School of Health. If you would like to know more about us, please visit our website that will be posted on the chat box. So about Empower, Empower is a capacity building organization and has worked in over 100 countries. I hope you have seen that was described by Professor Paul during the slide deck that we played in the beginning of the webinar. So we worked over 100 countries across multiple languages to strengthen the institutional and HR capacity of global health and humanitarian program through digital learning interventions. Our reach has already been reached out to 200,000 public health professionals globally, and we have mainly three focus areas: leadership and change management, digital learning, public health, procurement, and supply chain. Then you can see on the bottom, we have 5 domain areas: global health leadership, global health supply chain, COVID, HIV, TB, malaria, nutrition, etc. New product introduction, medical lab diagnostic training, health workforce strengthening, that is nurses, pharmacists, etc. On the left hand side, you can see our clients, and there is another slide which you can see that with all clients and organization we have worked for. This is the partnership and our collaboration across Africa. You can see there are universities, there are councils, there are societies. We are already collaborated and we are doing regular activities with them. This is the slide which shows partner, client, and funder of Empower School of Health. You can see government bodies, UN agencies, donor agencies, academia, implementing organization, and professional associations. Recently, we have collaborated with UNITA and we have launched our master's course with them. This slide will show you our advisors and faculty members. Professor Paul Lalwani, he's our director, Empower School of Health, former head of Global Funds, Procurement and Supply Chain Division. Professor Andy, he's a director, Training and Capacity Building, and he's one of the speakers for today's event as well. As you can see, this slide will show you the courses that we offer. We have multiple of long-term and short-term courses. Our short courses, they basically start from 1 month to 2 months. Then we have postgraduate diploma, that is for 12 months. And then we have recently launched master's course in global health procurement and supply chain management, and that is for 12 months and 24 months. And this is available in 2 languages, that is English and French. The slide deck will be shared with you all. So if you want, you can, if you have any particular question regarding any of the courses, then you can get connected with us. The email ID will be shared on the chat box. So I would like to give you a brief information about master's course. We have two categories under master's course. That is one for 12-month course. I'm sorry. Another one is for 24-month course. 24-month course is eligible for all the candidates, but 12-month course is only eligible for those who have completed postgraduate diploma with us. And we also have the fee structure is mentioned on this slide, but we have partial scholarship seats also that will reduce the fee. In order to know the more information about it, I would request you to please write us on the email ID that will be posted on the chat, or that will be provided on the next slide. What is the process for applying for the partial scholarship? So you can do one thing, you can just go to the website, you can fill up your respective application of the required course, then concerned team will get connected with you, or you can write on the email ID which is mentioned over here on the second point, that is operations@Empower School of Health and info@Empower Swiss. Now I would like to invite Professor Andy to just briefly describe himself and taking care of his slides. Thank you, Professor Andy, and thank you all.
Okay, greetings to all. Right, who am I? I'm Professor of Public Health and Director of Training at the Empower School of Health. I've been working in this area for nearly 40 years now. And a lot of that time has been involved in training, particularly around healthcare, procurement and supply chain management. And I have a lot of experience in developing and delivering training courses. But one of the key points that's come across in my experience is the reality that we have to fundamentally change how we undertake human resource capacity development. And now the technology has enabled us to make that change. And I'm going to try and describe in the next 30 minutes or so what that impact is and how we can harness that technology. Next slide, please. So I'm going to talk about this idea, back one, please. Okay, of big learning and what this big learning approach and scalable learning particularly means. Okay, next slide, please. If we look at the Sustainable Development Goals number 3 for healthcare, we find we're failing to meet them. We're not achieving the Sustainable Development Goals in health. And one of the reasons, because there are many, that we are failing to do that is we're failing to get medicines and medical supplies to patients and the people that need them. Even when we have the funds, even when we physically have the supplies, we're not getting them to the people who need them. Our supply chain is just not operating effectively in low-income countries. And we see the UN Commission here, we could save 6 million lives if we got that supply chain to operate. It operates in high-income countries. It's not operating well in the public sector in low-income countries. And that's the harsh reality that all of us who work in this field must face. Next slide, please. So the obvious question is, well, why are our supply chains performing so poorly? And the simple answer is we don't have the trained staff in place. We don't have the human resources. The people who are undertaking supply chain activities have generally never been trained, only very littly trained in supply chain. It's typically a pharmacist who's told, now you're in charge of supplies, or a nurse who is now in charge of supplies, and you must still carry on all your nursing duties. Occasionally, it's a clinician, a physician, a doctor who is put in charge. There's no training at medical school in supply chain management. These people are now put in that position solely on the basis of them having medical knowledge. Occasionally we get IT and management people put in that position as well. The common factor is they don't have the capacity, the training to undertake those tasks. Next slide, please. And if we look at the scale of the problem, we find that World Bank is saying it's 30 to 70% missing on supply chain professionals in the healthcare field in low and middle income countries. It varies around the world. The situation in East and West Africa is slightly different, and it's different in East Asia and the Pacific. But overall, the common denominator is we don't have trained people. We don't have the people in the position. They haven't had the education. They haven't had the training and skills development needed to undertake the task. Next slide, please. Global Fund, many of you will be familiar with the activities of Global Fund. Again, estimate 70% of positions are unstaffed or staff who have never been trained. And that's making the whole supply chain fail. So we have unqualified and disempowered staff, means the supply chain are poorly managed, means we get poor availability of commodities and wasted resources. We have medicines expiring. We have a critical need for medicines, and we're allowing medicines to expire because we're not managing the supply chain correctly. And that means we're underperforming in health programs, and we're not achieving health goals, and we're not achieving the Sustainable Development Goals for health. On top of that, over the last few years, we've seen massive increases in the volumes of medical supplies needed. Rapid diagnostic tests have revolutionized healthcare, but it's a huge volume of malaria test kits and HIV test kits and TB test kits to manage. In volume terms, a 20-fold increase. So we need a fundamentally different approach to how we do supply chain. A 5-fold increase in the overall operation of supply chain for medical supplies. Massive increases at a time when we don't have the capacity. Next slide, please. Well, why don't we have the capacity? Guys like me have spent years traveling around the world delivering face-to-face training. And the problem is, it's really not worked that well. It's worked a little bit, it's delivered some benefit, but not much. I've been to 42 countries delivering face-to-face classroom-based learning on medical supply chain. However, we estimate there are 30,000 people in the world that need training. If I deliver a 1-week class for 20 people, it's going to take me 300 years to train everybody. It's impossible. It's not scalable. I'm not even starting to achieve the scale of training that is required. Further, much of the training has not been beneficial. It's alienated the trainees. Too much talk and chalk, not enough focus on relevant activities. Next slide, please. So how does this training work? Well, not very well. It's not efficient, it's not cost effective, and donors have spent a lot of money paying for consultants to fly in to deliver a 1-week course, which has got little effect. It's clear these trainings are not sustainable, they're not sticky. They have a short-term impact, gets a little bit better for a short time, but then staff are transferred out and it's lost. People are moved on to other positions because nobody wants to be, because they're not supply chain people. They're pharmacists or nurses or doctors who've been pushed into a job they don't really want to do. They've not developed that capacity and career function. Overall, this approach has limited short-term impact, poor sustainability. It's clear we're not winning on that traditional formula. And there's lots of references to indicate that that is the case. Next slide, please. So why doesn't this training work? You're spending all this money, you've got world experts flying in to deliver it. Well, firstly, there's no ownership. Often it's a donor-driven product. It's following what the donor wants. We laughingly have a thing called the golden rule. What's the golden rule? The one with the gold, they make the rules. And that's what happens here. It's the donor priorities, the donor focus, not necessarily what the country focus wants or needs. We have a one-size-fits-all training package, and it's usually not appropriate. It's not in the local language. It's not appropriate to the local culture and environment. It's not linked to the job or career structure. It's very academic. It's not linked to what people are doing in a medical warehouse or dispensing to patients or handling any section of the supply chain. Frequently, it's not up to date. Many of the supply chain training courses still talk about the British Constitution. Countries have been independent for over 40 years. Why are we learning about the British Constitution, which doesn't actually have a written document? Aspects like this have to be moved on. Often, I'm afraid, it's not a quality product. Online learning has developed a bad name. Too many people think all they have to do is put a few PowerPoint slides on the internet and bang, it's an online learning course. It isn't. Online learning must be specifically developed for the environment and the media. And often it's not sustainable. The donor flies in, does a little bit and departs. It's gone. There's no follow-up, there's no continuation. It's not happening. So we have plenty of shortfalls on the training. Plenty of areas where we must get improvements. Next slide, please. So we have this great need for quality procurement and supply management training. There are not enough courses around, and many of the ones that are around are exceedingly poor quality. I'm sorry to say that. Too often, it's not adult-based learning. They are taking a school program and trying to move that into an adult environment. It doesn't work. In Empower, we try and follow the ADE methodology to analyze, design, develop, implement, and evaluate. So it's not all talk and chalk. It's about explaining the problem. How do we formulate a solution? How do we develop and implement that solution? And then how do we evaluate if it actually worked? This makes the learning directly relevant to what everyone is doing. It's also essential that we have a way of measuring competence, personal competence. How well are you doing? How well are you improving? And also competence for the country. How many qualified staff do you have and are available to you? Linking the specific training to actual real-life job functions and the standard operating procedures and job descriptions that are in place. Next slide, please. So it's clearly time for an entirely new approach. Excuse me. And we call this big learning. How do we get scalable? 1 week classroom courses are not going to do it. We have to move to a digital big data environment. That's clear. But it must also be country specific, country owned and country managed. And I'll explain now what we mean by this big learning. Next slide, please. Right now, training is often considered static, one time. You fly in, deliver a course, that's it. Training's done, tick the box, all finished. That's not how training works. That's not how capacity development has ever worked, especially not in the medical area. There are new medicines, there are new treatment regimens, there are new diagnostics all the time. We need to continuously update, continuously adapt. And that means that the policies and the technologies are continuously changing. And we need to develop a system where we can have continuous capacity development. We talk about CPD, continuous professional development, and yes, that's certainly beneficial. But a 1-hour seminar once a month is not going to do it. We can only just introduce the concept there. If we are going to ever reduce this human resource gap, we have to be able to continually develop human resource skills and abilities, skills linked directly to job functions and directly to daily activities. We call this the dynamic approach, not a one-time tick the box training done, but a different approach to a lifetime of learning, continuous development, continuous progress of staff and everyone involved in the function. Next slide, please. And we believe that digital solutions with an approach like our big learning platform can be part of the solution towards building a resilient institutional memory and a resilient human resource capacity development. We're not dismissing face-to-face classroom trainings because they still bring strong engagement, strong encouragement to everyone, but they are expensive and they're absolutely not scalable. How many people from the rural areas can I bring into the capital city and train and send back again? It doesn't make sense. I can never get the scale. And again, I talk about we estimate 30,000 people. I'm not going to do that on classroom training. I need to have an approach which reaches everyone. Unfortunately, the digital environment provides the technology to achieve that. Digital learning platforms are scaling in developing countries. Unfortunately, what we found is many of the online courses are not sticky. A lot of people sign up for them and then never follow through. 2 or 3 lessons and they drop out. We're not engaging with them. We're not keeping them motivated. Just putting PowerPoints on the internet doesn't do it. It has to be an engaging online experience. Not just talk and chalk, move to the internet. Also, professionals need easy access to information, policies and guidelines. How many of you in a rural clinic could find your standard operating procedures, or a copy of the essential medicine list, or a copy of the formulary? Well, we had one once, but where is it? Can't find it. All of this instantly available through the digital environment. We don't have to go hunting and searching and trying to borrow photocopies of a photocopy of a document that was produced years ago and is long out of date. We've got them all available in one place online. Fortunately, digital literacy is growing. Many people have a mobile phone now, even in remote rural areas. They understand how to use it. They understand how to get to the internet, how to get information. This digital penetration is expanding rapidly, and we must try and take advantage of it and use it and engage with it fully. Also, the cost of digital infrastructure, and especially bandwidth, is declining. In many countries, it is still high. It's still a restricting factor, but in time, it is reducing. Nearly every month, it is reducing. Fundamentally, it's a new approach. Just online learning alone, no. We talk about blended learning, where we have a full learning experience, which might include some in-class capacity building. But fundamentally, harnessing the digital environment to bring us the scale. And that's now possible because of the technology and the growth of that technology into even remote rural areas. Next slide, please. So this big learning solution is really in 4 parts. And these are important, and we put this first because we consider it the most important. Peer-to-peer learning. You connect with everyone else that's doing the job in your country. You ask them, how do they do it? What does work well for you? How does that happen? Direct peer-to-peer learning. People who've already been trained share their learning, share their experiences across the whole area. Multi-country, if countries feel confident to do that. It allows different approaches to be tried. This region might try a different approach to that region, compare them and see how they do. This peer-to-peer learning is essential. We have all this knowledge in the country and we're failing to harness it. We can't bring everyone together for a meeting, and even when we do, they have no time to talk to each other because some old professor is droning on the blackboard with talk and chalk. This links together everyone. A quick message. How did you do that? How is your stock going? How are you doing on this? Invaluable. Then the knowledge center, a repository of all the knowledge, everything where you can find it in your language. All the policies, all the standard operating procedures, all the formularies, all the medicines list, everything there that you need. In effect, like a wiki health for your country and program. What's the latest medicine to treat TB? Bang. Look it up, there's the answer. For our country, for our environment, for our region. Everything located there directly for your direct use. Next slide, please. Part 3, the learning and development platform. Effectively, all the training courses, but not just training courses, to measure the human resource capacity. Everyone linked to personal capacity development, a competency assessment. How well are you doing collectively? How well is the country doing? Which areas do we need to strengthen? Both global and national courses, most of them free of cost, not all. University degrees rarely come free of cost, so those are a bit extra, but many of them on specific subjects are free of cost. Everything there. Trying to find information on the UN and WHO websites is a nightmare. They change the URL nearly every week. Locating that training video, it's disappeared. But here we've got everything together in one place. You ask for, what's the storage condition for the latest TB diagnostics? Bang, it's available. What's the training for handling these medicines? Bang, it's available. A little training course, a little webinar, everything there in the learning and development platform. Everything from a full operation to just specific little areas. Finally, part 4, a technical assistance platform, where we have experts that you can consult and ask for technical assistance in any of the areas, whether it's an IT issue to get these learning and development platforms up and running, or whether it's a technical issue relayed to one of the many technical experts who are available in the field. So 4 parts to this big learning solution. Next slide, please. It's a fully integrated process. Fundamentally, it's country owned. The country takes this on. It's country specific. It's cloud-based, so it can be accessed from anywhere. And it's country managed. The fundamental change here is this program is no longer donor driven. It's no longer the golden rule. It's now what the country wants. The country recognizes the need for skills and capacity developments and takes on this solution to operate it. The 4 parts of the peer-to-peer ecosystem, the knowledge cube, the learning and development platform, and the on-the-job technical assistance. Empower can help countries to establish this, but fundamentally, it is a country decision. This is what they want, and frankly, for many, must do. And it has to be absolutely country specific. Otherwise, it will never be sustainable. Next slide, please. This concept has been developed using many people, including software engineers, ITs, gamers and simulators, because that's part of the learning and development. The learning and development is not just old professors droning on a few slides. It's case studies and games and simulations and doing what-if laboratories. If I try this, what happens? If I try that, how does it work out? And the key benefits of this is one platform, immediate on-demand access. It's available the last mile if they have internet services. And it's user-centered. It's based around what the user wants, not what academia dictates to them. So it's a fundamental change in the way we go about addressing skills development, where the country takes charge and it's user-driven, because they recognize the need to acquire these skills and to develop the capacity. Next slide, please. Here's an example of how one looks. This is the English language one. Of course, there's a little welcome screen, and you can see along the top the different options that we talked about, the 4 parts of it. all together in one place, the knowledge tower, the courses, learning development, the technical assistance, and then for each user, their particular platform. It's made user specific. So if you're a pharmacist undertaking supply chain, it's got the essential medicine lists. If you're a doctor, it's got the treatment lists and the formulary, because you've kept them in your particular platform already in case you need to reference them. Next slide, please. Course you register, straightforward. Enough. Each candidate registers. It's open to all across the whole of the operation. The education and profession is just linked because some areas like control medicines are limited to certain healthcare professionals. Those areas might be locked out to non-professionals, but otherwise it's available to all. There are limits on treatment levels. For example, cancer medicines would only be available at tertiary hospitals. That would also be a filter that's applied. But in general terms, most of the information is available to everyone. Next slide, please. And then as your user platform, you register the areas that you're interested in. You might be interested in tuberculosis. What money and funding is available for us? And what products can we get through those funding sources? Because often the specific product is tied to the funding source. If you have a global fund grant, funding by the global fund, then you're only allowed to buy specific products. Which products are they? Well, they change frequently. So here we are directly to that information. And many other areas for your particular interest. This is your platform. It's made customizable directly for you. Next slide, please. We talked about peer development, peer cooperation, typically a map of where are all the peers in your country. So map it out using a similar profile to EpiMap, which some of you might be familiar with. Where's everyone located? Who are they? I can filter it, the ones that are closest to me, the ones that have a similar work profile or whatever, directly, and then I can call them and interact with them and message them. What works for you? How did you solve that problem? Are you short on diagnostic kits? What can we do? Perhaps transfer from other areas. All there, linked together, calendars, meetings, you can have continual professional developments together, chats and forums together on all activities. And we stress again and again the value of peer-to-peer learning. People in the same position, in the same job, in the same environment as you, sharing their knowledge and experience. Because even at the best of conferences and workshops, somehow there's never enough time for that to interact effectively. Next slide, please. Okay, so we talked about this knowledge tower where everything is linked together, but again, you've got your own platform, so you can filter out what's specific for you. Next slide, please. There we go. The Global Health Knowledge Cube, all the information globally. Next one, please. Okay. And then linked to your specific country and your specific environment. So there'll be a global malaria program, but then what's the malaria program in your country? That's the Malaria Cube. What would you keep in there? The policies, all the guidelines, the manuals, the budgets, the strategies, the standard operating procedures, the operational plans, the product list, everything available to you when you need it and sortable so that you can ask a specific question and search through and get that answer. We've seen immunization, new technologies, antimicrobial resistance, lots of areas all there available to you directly and immediately. Next slide, please. The learning and development, and again, next, please. Okay, is linked to the competency assessment tool and self-analysis. So basically, we ask individuals to undertake a competency assessment. We start with their education and work profile. We look at their competency mapping. How do they feel about it? And then we do an assessment. They take a quiz. And we follow through on that quiz, and in more detail ones, they take a test exams. And then we give them a report. That report is confidential to them, but we collate all the reports to give a country one, which has no personal information in it. So the country can see, I have 300 people who are all experts in procurement of TB medicines, or I have nobody who is really good at managing waste disposal of control medicines. So from this, I get my country profile and the individual you get your personal profile, where you are strong, where you are weak. The people involved in warehouse operations might not be too interested in strengthening procurement skills, so they don't have to worry about that. We can focus on taking courses in warehouse management and in supply chain operation in and out. How do we get the flow operating smoothly and constantly? Each one can decide themselves, and we collate it to a country report. Next slide, please. And this is the kind of domain-based competency mapping that we undertake on this radar chart. So you can see at the very top, select the appropriate product. Who has the knowledge to select the correct medicines? Around at 3 o'clock, building and maintaining supplier relationships. That's for the procurement team. And around the bottom at 6 o'clock, warehouse and inventory management, obviously for the warehouse team. Where are you strong? Where are you weak? You can see what the scores are for you, and then you can see how to develop it and use the knowledge and the training cubes to help you develop for your specific areas. If you're already strong in procurement, you don't need further development. You're already doing fine, and you can strengthen other areas if you feel it's appropriate. Again, the focus has changed from academic and donor-driven to personal user-driven. You decide what extra skills development you want and are appropriate for your environment, and the country can see exactly what resources they have available to them. Next slide, please. So once you've done the competency assessment, then you decide which courses you might need to take. Short courses or a complete course, a long course in training and procurement and supply chain management. Are they all free? Most are, but not all. We're looking to know national. Do I need international training? If you're operating procurement on the international market, perhaps it's there. Do I need management rather than technical? I know all about pharmacy. I know all about medicines. It's the management that I need strengthening. Then management courses would be more appropriate to you. They're all available in that learning and development section. Do I need a certified course for my career? Has it got to be approved by a UN agency, a university body, or ISO perhaps? Am I happy with online learning? Does it work for me? Or do I need a classroom-based course in this particular instance? All those are available to you. You decide, following your own competency assessment, where you feel you need that additional skills development. Next slide, please. Technical assistance, and the next slide, please. And I think it should, there we go. What's available? Question and answers. You've got your peer group. You can ask your peer group. If I can't get an answer from within the peer group, I can ask the technical assistance centers. We have a team of mentors and experts. You can, which documents I can't find the WHO guidelines for. Family planning commodities. Right. We can resource that for you. We can help find it. Put that all together, and that is a relatively quick response. We can also take a tour around. Let's look first at the mentors and experts. Next slide, please. So Empower has a team of mentors and experts, but in this big learning, we expect you to develop them for your country. Who are the experts in the field? And some will be universities, and some may be UN agencies, and some may be other areas of activity in hospitals or likewise. Those are the experts that can be called upon for the answers all the time. Who is the head of the Medicine Selection Committee? Who is the head of the Drug and Therapeutic Committee? Perhaps they can answer that question. They can be one of the mentors and experts that we can call on. Who's doing really well in supply chain, a star performer? Let's put them in the mentors and experts box, and we can then message them and ask them for specific guidance in particular high-level areas where we might need support. My IT system's not working. I can't access the internet. What about some technical support in IT? Again, all of that in the mentors and experts section. Next slide, please. Can also take a virtual tour. What does the central warehouse look like? What have they got in stock? Well, with webcams, we can now do a virtual tour of how it is. What about the provincial warehouse? Again, with webcams, we link that in. You can do the virtual tour of what's there, what's happening, how can I connect with them and see how I can make the supply chain more efficient and operational. Similarly, with UN agencies, many NGOs, some of the donors now are doing that, and academia, I can take the tour around and see what is actually happening on the ground. Next slide, please. So in summary, the traditional approaches to training and skills development are just not effective in developing a professional cadre of health supply chain staff. This new approach we're suggesting is the big learning platform, which recognizes this need for a dynamic strategy, a fundamental change away from taking skills as a one-time tick-the-box operation into a lifetime learning. Countries taking direct ownership of the whole skills development area. Sustainable long-term development. Continuous professional development, yes, retraining and updated training constantly, and having it available immediately online to all. Big learning platform is one approach that brings that opportunity. Our key message is countries have to own it. They have to accept the fundamental change, the free strategies for dynamic professional learning. No more one time, it's now a dynamic lifetime experience of learning. I believe that's the end for me. Thank you very much for your time. I'm just within the time frame, so I pass over now. Back to Sonia.
Thank you, Professor Andy, for your presentation. And I hope participants will get benefited out of your presentation. I can see Professor Paul is also joined us today. So Professor Paul, if you have a few words to say.
Can you see me? Can you hear me?
Yes, Prof, loud and clear.
Okay, wonderful. First of all, thank you. Wanted to thank, well, first of all, the speakers, which is fantastic. It's always great to hear Professor Andy, and also to hear Andreas, one of our colleagues and partners that brings knowledge management into this whole area and brings the professionalization. So thank you very much for that. Each time I listen to you, I learn, which is great. And it's wonderful to see the audience from all over the world as well. And I just wanted to share with you that this is an area of work that we are working with various ministries of health, with various donors, because it's a need that is so vital because of what we say continuous change in terms of this continuous change that happens because of accelerated innovation. And at the same time, we're looking at new policies, new products, new processes, new people. And you cannot expect that just simple training or sharing of PDF documents will get us there. Individuals, organizations, everyone is so spread out, whether they are an international organization or within a country. Take Ethiopia, take Nigeria, very large countries, but even a small country like Ghana, which has a population of under 30 million, but more than 100,000 health workers, for example, spread across the country. If you don't have these knowledge systems, learning systems, and you bring in technology to help reduce cost and bring your ability to map and learn and customize the learning, you would never succeed. Okay, so I thank the speakers and I leave the floor back to them to guide the discussion. Thank you so much.
Thank you, Professor Paul. Now, I would like to invite Dr. Andreas. He's the Managing Director of Knowledge Management Associates. He brings deep experience with more than 18 years of work in the field of consulting, training, and research in relation to knowledge management and policies of knowledge. In 2002, he established the Knowledge Management Academy, which provides international certification course in knowledge management with highest level of expertise. Now, I would like to give floor to Dr. Andreas. And please, if you would like to brief yourself briefly, Prof, and you can take care of these slides further. Thank you so much.
Thank you very much, Sonia, and also thank you very much, Professor Andy, for your wonderful presentation, which was also for me very inspiring and educative. Yes, I am working in the field of knowledge management for more than 20 years, as you have mentioned, and for more than 10-15 years, I'm also specifically working on the development of knowledge societies and how we can manage knowledge in countries, as you have said, Ghana, or I'm currently working right now quite passionately in Uganda. And the Knowledge for Development Partnership, which is also indicated here with the logo on this slide, is a global platform that connects professionals, experts, and all those interested in knowledge societies to come together and share experiences and co-create a sustainable knowledge society. I just want to make sure that you can see my video. Is that the case?
Yes, Prof, we can see you. We can hear you.
Yes,
also.
okay. Very good. So if we go to the next slide, I just want to mention very briefly, Andy, the next one, very briefly our understanding of knowledge. Knowledge is as a resource for societal development, not only an agglomeration of knowledge assets that we collect and we have them, we own them either as a country or as an organization, even as a person. We can acquire something, knowledge, skills that we have learned in the past, but this is not enough. The columns of knowledge, this nice artwork that has been developed by an Austrian artist in 2008, says there are two different aspects when it comes to knowledge. The left-hand side aspect is represented in with a highly polished steel column that represents excellence. And it shows this is something that has been proven in the past. It is reliable, it is scientific, it is part of a routine that we have applied many times. It's highly polished, it's almost perfect. Well, in this shape, it is perfect. It has no mistake. And the good thing in this shape is that it can work very well, like a motor in a cylinder in a motor, sorry, that can rotate 1,000 times per minute, and we have no mistake, no problems. So this is something which we enjoy. On the other side, you should keep in mind that whatever is perfect is not very adaptive to learning. And when we think that everything already works well, then what shall we add? So whenever we feel comfortable with something, we should already get a bit skeptical and always move beyond the existing knowledge into the unknown, which is represented by the right-hand side pillar column. And you can see that probably in this small version which I hold here, it's a triangle and prism in the three-dimensional space. On the outside, it's broken and rough, like an acre, and it represents the not knowing, the learning aspect, where it's not yet clear what will be, what is true or wrong, how to practice things. And this is not a mistake. This is part of our knowledge identity. So we always have to link what we know with what we don't know and the challenges in the future. And linking knowledge with current challenges and opportunities is what we and the artists determine and describe as knowledge. How to link, how to connect the dots of our global organizational and individual dots, this is what really counts. And this capability of making use of knowledge, of finding, acquiring, using, sharing, applying it, this is based on what we see here as a symbolized book. It represents fundamental education, which we also could call the knowledge skills. It is the ability to read. It is the ability to learn. It is the ability to connect the dots. It is the ability to reflect, to criticize, to share, to present. All these skills are fundamental for us to be able to make use of the plethora of proven and existing knowledge, and also to solve new challenges in the future. And we give this award in the small version, as you can see here, every year to outstanding personalities that are pioneering the knowledge society and knowledge management. So let me continue. I hope that this metaphor of this artwork gives an inspiration and also shows that this is not only about collecting and structuring knowledge, but also to co-creating the future. Please, next slide. Next slide, please. Yeah. Yes, you can go dot by dot. Knowledge management really is a topic that is already existing. We have knowledge management in project management, for instance. For instance, we have learned that at the end of a project, you should capture the knowledge through lessons learned or an after-action review so that it will be available for the future. However, reality shows that lessons learned are hardly used by others, and that's why the real learnings of projects very often disappear. And Andy has spoken much about donor-funded programs. And we realize that every day and every year, again and again, that when a project that has been funded all of a sudden closes and the funding doesn't continue, then also the knowledge is lost, and continuity is probably very limited. And the same appears to process management, communication, IT. The IT departments usually are there to facilitate the exchange of knowledge. But the reality is that they mostly just install the hardware and software and make sure that everybody can use the laptops and has the user rights and this and that. However, understanding the knowledge flows from projects to processes to communication, what is the role of human resources, and to facilitate all that with technical instruments, this is not what IT department can do. And we can continue that. The human resource departments usually provide trainings, but they are sort of standalone activities in many regards. And that's why knowledge management comes in place and says, we don't need only trainings. We don't need lessons learned. We don't need a super platform. We need the competence to solve our problems, to deliver services and value to our customers. And we need knowledge to do that. And this is an overarching perspective that requires that we jump out of our dots and silos. Next slide, please. We come together, we think about the real challenges that we have. For instance, fighting a pandemic. For instance, decreasing early childhood diseases or death, etc., etc. And please, next slide. It requires that we jump out of our silos, and next slide, that we create a common perspective for the knowledge that we need. Next slide, please. And that is what we call knowledge management, or on a societal level, a national knowledge agenda. Because what I just presented to you on organizational level, the same is true on a national level, where there's the scientific organizations, the companies, the ministries, you name it, they all have their own dots, they work in their silos, but still it does not work. Because what we need on a national level is a knowledge partnership, for instance, for health development, so that scientific innovation is immediately shared and applied in practice. And that cannot be done by science alone. It requires all partners. It requires collaboration in a society. That's what a knowledge management or knowledge agenda approach can deliver. But next slide, please. This requires also models. Systematic, targeted, integrated knowledge management requires a model that structures the flows of knowledge. If I have knowledge, but I cannot find it, then what is the value of it? If I can find it, but I cannot access it or acquire it because I don't have the financial means, the language skills, it does not help me. If I can only acquire knowledge, but I cannot further develop it, transform it, then I may be outdated. So I need the ability to create. And what does it benefit us when we create knowledge, but we don't share it? So to make the long story short, we need a systematic, integrated approach where all the dots are linked and let's say also related to goals and a systematic management process. Next slide, please. And we can even further develop this methodological approach to a national knowledge management for development approach, and say if we want to achieve global, regional, or sectoral, like health development, organizational development, we need, of course, processes, products, but also knowledge resources and these knowledge processes I have mentioned. But it requires also good leadership and knowledge culture, roles, responsibilities, and of course, learning and development in terms of knowledge management. Next slide, please. And just a very simple tool, which I pick out of many to systematically identify which knowledge we need, is the knowledge resource matrix, where we follow our processes that we apply, for instance, in a hospital or as a consultant or whatever you do. And then you identify which knowledge as a human being do I need, which skills, education. But I also need codified knowledge like procedures, guidelines, as Andy has pointed out, the many, many codified knowledge resources. And additionally, there is a third category we usually work with, the relationship asset. Who can I ask if I don't know any further? Where is my community that can give me advice? Where are the external sources of innovation and learning and so on? And we can do this for each step. And when we continue with the next slide, you will see how this can be operationalized, for instance, in a consulting firm where you have pre-sales, proposal writing, staffing the project, and so on. And you can then determine exactly which knowledge you need. As soon as you determine the knowledge you need, you can also manage it, usually quite easily. Next slide, please. So this is just one example. And I want to close with one simple remark. It's not only about determining the knowledge resources, it's also about leadership. And I will give you this example of this sports person who is shown here. If you want to perform well, either in sports or in knowledge, you need a target line. You see, this person is really excited, happy, and enjoying his success because there is a target line. And if we do not have targets, we just tell our people, learn. Or we tell them, you should know that, you should share your knowledge. People will be stressed. Imagine you tell a runner, run. He doesn't know in which direction. He does not know if it's 100 meters or maybe 42 kilometers. He will be confused. We need for ourselves and we need for our colleagues to determine and clarify, what do we want to learn? What do we want to know? And I tell you, as soon as you have clearly determined it and you understand what you want to know, you can then find the ways to achieve it. And the training material, the equipment, the resources, the social recognition that is shown here. All this can be provided as soon as we have the clear target lines. And in many cases, knowledge is understood as a cloudy aspect that one cannot touch and not even manage. That we fail to install proper knowledge management infrastructures and practices. So I hope that you all will achieve your goals as long as you have determined and defined them and perform better in the knowledge society. I have only these few minutes to share my inputs with you, but I would really like to thank you, Power School of Health, for inviting me to speak very briefly, and I'm looking forward to further discussion with you. Thank you.
Thank you so much, Professor Andreas, for your wonderful presentation, and Professor Andy for his presentation as well. Now, this time slot we have assigned to Q&A session. So Professor Andy and Professor Andreas, I can see there are a few questions that has been posted on the chat box. I'll just put them one by one. Just give me a sec, please.
Yeah, I can see the question on staff attrition and knowledge gaps, which are quite high in Ghana, with internet connectivity and so on. May I make a brief comment on that from my side before Andy, you can follow up?
Yes, please, go ahead.
Knowledge capturing is indeed one of the very important steps in the knowledge life cycle that I have just shared with you. I did not address it explicitly due to the time limitation, but capturing indeed is a key process, and usually the one problem that we see is that as long as the knowledge is available, it does not create harm if it's not captured. So as long as the cook is in the kitchen, why should I write a recipe? Everything works well as long as the cook is there. But if all of a sudden the cook leaves, then we wonder, how has he done that? Maybe he should have written the recipe. And installing regular practices for capturing knowledge before the experts leaves, before the project is closed, before whatever happens, people move in within the organizations, is a very critical aspect. However, the practice of knowledge capturing and sharing has to be integrated in a systematic knowledge management approach, because without responsibilities for doing it, without the practices that are provided, that are followed up, monitored, application is monitored, without someone who is, let's say, keeping the whole process in mind and making sure that it works well, none of these knowledge processes will really be sustainable. So knowledge really requires cultivation and continuous care. And without a knowledge manager and a systematic approach, usually things fade out. Once you realize, oh my God, we have lost an important person, you do something, but then after a short time, it disappears. So I'm really promoting a systematic, targeted, and structurally anchored knowledge management approach that, among many other activities, is responsible for the systematic capturing of knowledge before people leave. Over to you, Andy.
Okay. Staff attrition is high, especially in supply chain, and frankly, is likely to remain high off into the foreseeable future. Until the profession is fully recognized, it's going to be always staff seconded into positions who don't really want to be there, and when they get the opportunity, they will leave. But that emphasizes the need for this systematic knowledge management approach. Training is not just one time, it has to be available continuously. Skills development has to be available continually. So all the new staff can access the skills development that they need all the time. As soon as they start the job, they can sign on for the courses, for the knowledge management, for the skills development. The problem is we've got no knowledge management. That knowledge is lost every time somebody leaves, and they have to build it up again. We need that institutionalized in country, so it's available. Internet connectivity, yes, it's still poor in some areas, but it is improving nearly everywhere. It is getting better. And as it gets better, we must seek to roll out and to access. We can't wait till it gets better. It will take us time to develop knowledge management. It's a fundamentally different approach for government bodies like the Ministry of Health, like the Ministry of Education, like academia, to accept. Many of us are siloed and cast in concrete. We have to break that down and move out into this knowledge management sphere. And platforms that do that are essential. So yeah, there are limitations around what we can do, but we must start to address them. We must start the knowledge management. Okay, Sonia, next question, if you have it, please.
Thank you, Professor Andy. I can see there is another question that is specially for you. What do you think about having a mentored technical expert to enhance skills, building transfer alongside the online skills development?
Yes, the mentors we fully support, we fully accept. But again, before we go to mentors, peer-to-peer learning, contacting someone else, sharing knowledge. We have this idea that somehow knowledge is the sole domain of academia. It isn't. People who are doing the job have got practical knowledge and share it on peer-to-peer. Having the technical assistants and mentors is great, but let's start with peer-to-peer and sharing. Professor Andreas, do you want to come in on that point as well?
Well, mentorship is an important concept in organizational knowledge management, and it just gives me the opportunity to talk about the various roles and responsibilities. And let me say one thing: the responsibility for knowledge management starts with the management itself, not with the knowledge manager. Except you define the CEO as the knowledge manager. But knowledge is the most important resource for any operation. When we even talk about a core competence as a strategic asset, then it means we can do something better because of our knowledge. And taking care that this knowledge is available is the management responsibility per definition. Knowledge managers, yes, they can coordinate activities, and they can even coordinate a team of experts from IT, HR, process, project management, operations to follow a common knowledge agenda. But then also every single individual, the knowledge workers, they have responsibilities to search for what is existing before reinventing, to share whenever there is something new, to guide others, to support, even to ask questions. It's not self-understood. There is also the specific role of the subject matter expert or a lead expert in a thematic area, who is responsible to make sure that in a domain you always are working at the highest level of expertise. And those subject matter experts can be also ideal mentors for young people. So it could be one role of such subject matter experts to always instruct, guide, support, mentor young people and share the experience with others. But mentoring is not only limited to a few people. I think everybody can mentor others very systematically and structured on the one side, but also quite informally. And I think that it should become a common practice. Everybody who has experience and is already at the higher end of knowledge, state of the art, should think about, who am I mentoring? Do I have mentees? I can ask all of you that you are here, 30 people. Many of you are for sure experts in something. Who are you mentoring? Do you have young people, juniors, who you regularly support, who you guide, who you advise, who you follow in their career? I think everybody can do that. And even if you are younger and maybe at the beginning of your career, you can think about, who is my mentor, even if there is not the formal role of the mentor. Because mentorship is not only an activity of the elderly or more experienced people, it's also a matter of the young ones. Because you have to appreciate, you have to ask, you have to recognize. If as a young person you don't ask the senior people for something, if you don't appreciate their efforts to guide you and inform you, if you don't provide them an opportunity to share their knowledge, they will not do it because they don't have to. They are not depending on you. It's a gift that they give you. But if you don't ask for it and if you don't appreciate it, forget it. They will not do it, at least not for long. So I think that we all have to be more sensitive about mentoring, about our responsibilities as knowledge workers. We should specifically develop an appreciative culture. That's what I really have learned about those years in knowledge management. Without appreciation, people will have the knowledge, but they will not share it. You cannot squeeze knowledge out of a person like a lemon. You cannot even force them when you tell them, you document this. They will write a document, but it will not be what you want. Appreciation is the foundation for knowledge management as much as for any knowledge culture. So let's start appreciating each other, giving applause, giving respect. Even if you think it's a different opinion, appreciate that this person has shared something with you. Help him or her to grow if you think that you know something that could be beneficial. That's how we can learn from each other. Thank you.
Okay, Sonia, I think we're exactly on time there for the end of the Q&A session. So over to you for the polls and closing.
Yes, Prof. Thank you, Professor Andy. Thank you, Professor Andreas. Professor Andy, there is one another question, small question uh, that I can see. Is there a cost for registering to the big learning platform?
Okay, the big learning platform, the country must adopt that system. The country adopts it. Normally, there's no cost for registering, but the country must adopt it first. It has to be a country-owned system. We don't operate a global big learning platform. It's country-specific, owned and operated by the country. So if your country adopts it, then it becomes free of cost for all the government-related staff to use it. But country must adopt it first. We're not giving it away as a global operator because it's country specific. Okay.
Thank you, Professor Andy. So now there are a few questions more related to the slide deck. So as informed in the beginning, the slide deck will be shared with all the participants along with the webinar recording. And so now it's time for launching a poll 2. I would request my backend team to please launch poll 2. And I would request all participants to please participate in the poll. This is, we are just moving ahead for closing the event. So as you can see, the first question is what percentage of information was new to you? You just need to select the respective answers in the front of the question. And we will wait for a few seconds and then we will share the results with all. So 100% participation is needed for this poll. Yeah, so now it start moving. 4% of the participants as of now participated to the poll. I would request others. It doesn't take much time of yours, just few seconds. You need to just select the respective answers and then we will close the poll and share the results with all. %. Yeah, gradually it's moving. 52% participated. We have 40 more % to participate in the poll. We will wait for a few seconds and then we will close the poll. We will be sharing the link to download your certificate of participation after this poll. So I would request all participants to please fill up your form and the respective certificate will be sent to the respective registered email IDs within 24 to 48 hours. Those who have not participated, I would request please participate in the poll. This is the last poll and now we are just moving ahead to closing the event. Now I would request my backend team to please close the poll and show the results. So what percentage of information was new to you? That is 50 to 75% voting that has been given by the participant, and that is 75%. After this webinar, would you like to enroll for the courses offered by Empower School of Health? 88% says yes. So I would request those are interested, please visit the website or you can get connected with us. How did this session compare to your expectation? 50% says excellent, 50% says good. So we will try to improve as much as we can. How likely are you to recommend this session to a colleague? I can see 8 to 10 marking was given by 81% of participants. Thank you all for your participation. Now I would request my team to, so the link to download your certificate has been posted on the chat box. Please click on that link and the certificate will be delivered to the respective registered email ID. And special thanks to Dr. Andreas for your all your support and your cooperation to make this webinar successful. And we will be looking forward for further more collaboration like this with you and your organization. Last words from your side, Dr. Andreas and Professor Andy.
Thank you very much for these appreciative words. I really enjoyed being here with you. Thank you to all the participants for your questions and your attention. I look forward to seeing you then in one of the courses or in the Knowledge for Development Partnership. Bye.
Thank you all for being with us today, and please think about what we've said and try and advocate within your own organizations for knowledge management. Bye to all.
And at last, I thank all participants who have taken their time out of their busy schedule and they have attended the webinar. We will be coming more with such webinars, and that will be posted on the social media platform. We generally do webinars with all of our partners and universities. So for next upcoming webinars, the communication will be posted and transferred to you all. Thank you for your time. Have a nice day ahead.